optimum control of moisture and protection of the patient against aspirating materials, chemistry, exposure to the skin can occur by using a rubber dam. We have a template that's used for sizing the distance between holes that we'll place in the rubber dam for isolating the teeth. And in this exercise, which you'll be performing, we're going to be placing holes for tooth numbers 18 through tooth numbers 22. We place the rubber dam material over the template itself, and then using a pen, mark the locations for the punches. That's number 18, 19, 20, 21, and 22. And with the hole locations marked, we use the rubber dam punch. For the abutment tooth, we would like the largest hole where the abutment tooth will need to be stretched. The rubber dam will need to be stretched over the abutment tooth. We'll punch number 18 and number 19. Number 20, 21, and 22. I've used a double punch on tooth number 18, which will need to be stretched around the clamp. We've ligated the clamp with a piece of floss to prevent the patient from aspirating, or if the patient did suddenly get the clamp down the throat, we would have this string to pull it back out. We use the rubber dam clamp plier and engage the clamp plier in the holes on either side, and then we carry it to the mouth, first stretching the clamp open and placing it towards the lingual side below the crest of curvature, and then down onto the buccal. Of course, the patient will need to be numb, or you may get a complaint from the patient about pinching of the gum. We then carry the rubber dam material to the mouth using a stretching motion over the abutment tooth and clamp and pulling it forward. And at this point, with the rubber dam secured to the clamp, it might be helpful to place the rubber dam frame so we can more easily visualize and manipulate the dam material between the rest of the teeth. I like to come to the most anterior tooth that's going to be isolated, in this case number 22, with the most anterior hole, and carry the rubber dam material down between there, which anchors the rubber dam towards the front, and then using floss, carry the rubber dam material down between the rest of the teeth, carrying with the floss and pushing the rubber dam material down and pulling out to the side. And sometimes it will take several passes. Your fingers can stretch it from the sides, and then using the floss over the top in the interproximal space, carry the rubber dam material between the teeth. Ideally, the rubber dam material will cover the papilla and fold down into the sulcus in each interproximal space. It can help with 4 hands to have the rubber dam material held with 2 fingers while the other 2 hands are carrying the floss between the teeth. We're just about complete in flossing the interproximal spaces. There's one additional method of attachment, and that's to use a ligature on the anterior abutment tooth on number 22. We can carry the floss between on the mesial, and then again on the distal, and tie a knot in this area to secure the rubber dam at the mesial. Using this knot then will anchor the rubber dam in the front as well. Now you can see that tooth number 17 is a bit exposed here, and so we're going to use a smooth surface instrument like a plastic instrument to bring the material forward and then floss the rubber dam material down at the distal of number 18. as well. The next to last step before completion is to retrieve the ligature that we've placed around the clamp. Again, using a smooth instrument, we can get beneath the floss and pull that through so that we have our clamp retrieval ligature in case the clamp should disappear down the patient's throat. That now completes the placement of our rubber dam.